Child Life gave me the backbone and support that I needed to get better faster.
I was never familiar with Child Life. That was the first time I'd ever heard of it. It was amazing because what they were able to provide just to kind of break that heavy levity of the whole situation of what we were going through and be able to laugh and joke blew me away.
I was riding my manual scooter to McDonald's to meet up with some friends. I was taking a little shortcut through a parking lot. It had a bunch of unfilled cracks, and I was riding slow, hit a crack. A scooter went flying to the right. I landed on top, and I thought that I broken my leg. So I stood up to call my father, and that's when I noticed that I was just bleeding out. The scooter punctured my thigh, which then severed my femoral artery. That's when I knew to call 911. I remember being unloaded and then brought into the trauma room.
Due to the severity of his injury, to have the right surgical teams and equipment available for what he needed to go through, that's where they chose Denver Health. That was like the best experience you could hope for as horrible as this was.
We have attendings that are specialized in children, and we also have pediatric psychologists, and we also have Child Life. That is really important for a well-being of a teenager that's going to stay in a hospital critically ill and also for a longer time. We take care of neonates all the way to young adults, medical and surgical patients. And we are actually the only hospital in the state that can offer that 7 days a week. Our patients get to know the attendings, their nurses, psychologists and child life specialists quite well. We get quite attached to the families that stay here a long time. And I have lots of patients and families that have come and gone to other places, and they really feel that we are special. We can give excellent care, but it's much more personalized.
Child Life Specialist at Denver Health is here to kind of reduce the anxiety or fear of the medical world, whether that's procedures or diagnoses, or just to help them understand and cope.
Child Life is there to help us with a lot of different type of procedures. One of my favorite experiences is going in and having the Child Life specialist do the education prior to us walking in and being able to start IVs and having the patient not even know that we started an IV. I think that makes the whole stay at the emergency department a million times better.
Oftentimes we are doing IVs on Spider-Man so they know what to expect, or we're maybe playing with them at the bedside or preparing them for surgery with a doll or practicing with the mask. Other times it just is that normalization, bringing them into the playroom, helping them feel comfortable, advocating for what's going to be best for the child to reduce any trauma or medical trauma or pain management. And we wear multiple hats throughout the day. The other piece that we do is help out for any grief and loss, supporting them through that, whether it's siblings or families, and whatever we can do to be there for them.
The entire team was fabulous. Amanda, Kayla, Steph. Child Life is an amazing group for what they provide to children to make their stay better, to kind of make it more like home.
I would say that Child Life made the stay more fun. It was more important to have them with my hospital visit.